Hello and welcome to Health Dialogue Show. I'm Dr. Bhumika and February 15th is marked as International Childhood Cancer Day. And today we have the opportunity to gain valuable insights on the early detection, treatment and support for childhood cancer. During today's interaction, we will discuss vital topics such as early signs parents should watch for, common misconceptions about the disease, role of genetic screening in improving survival rates, and will also highlight recent advancements in childhood cancer research in India. We are privileged to be joined by Dr. Vivek Agarwala today, who will provide expert guidance and share his perspectives on improving care for children affected by cancer. Dr. Vivek Agarwala is an MBBS, MD, DNB, DM, has extensive experience in medical oncology and hemato-oncology. He currently practices at Narayana Super Speciality Hospital, Howrah. He has done specialized training in chemotherapy protocols, managing toxicities, oncologic emergencies, and bone marrow transplantation. He is a certified medical oncologist by the European Society of Medical Oncology. He holds MRCP specialty certification in medical oncology. Dr. Agarwal is interested in geriatric oncology, precision medicine, targeted therapy, and immunotherapy. He has published multiple papers in national and international medical journals. I welcome you to the show, sir. It's a privilege to have you here today.
Thank you. Thank you for this opportunity to interact with the audiences on the occasion of International Childhood Cancer Day. And I'm really happy to be here with Medical Dialogues. Thank you.
Thank you, sir. Okay, so first question to you is, what do you wish parents knew about the early signs of childhood cancer that could help with earlier diagnosis?
So, childhood cancer is not like very rare. Often parents think that children cannot have cancer. How can children have cancer? And this is one of the myths. So, even children can have cancer, and that is the reason why parents need to be vigilant about the signs and symptoms of cancers in childhood so that it can be detected as early as possible and treatment can be started as early as possible. So, if you look at what are the common childhood cancers, so if there is constant headache and vomiting in the morning that is not going away, then yes, there is suspicion that there might be some brain tumor, and brain tumors can happen in childhood. In newborn babies, if you look at the eyes, and there is a cat's eye reflex, you look at the cats and you see shining eyes of the cats. So if you see a similar kind of eyes in babies, newborn children, then you have to suspect retinoblastoma. Immediately consult a good ophthalmologist or a retinal surgeon to see if there is any retinoblastoma. Then, if the child has recurrent fevers, recurrent infections, failure to gain weight, constantly low appetite, unexplained fall of weight, swellings in the neck, armpits that is appearing, body ache, bone pains, then you should suspect that this can be a sign of hematological cancers like leukemia or lymphoma. Also important, if there is easy bruisability or presence of blood stain marks on the skin, and there is pale appearance of the child, then you should suspect blood cancers, which are common in childhood. Then if you see swelling in the joints or bony swellings, again the bone sarcomas are common in childhood and it should be immediately consulted with an oncologist. Also, if there is swelling of the abdomen or abdominal distension, then that is also one of the important signs and symptoms of abdominal cancers like hepatoblastoma, neuroblastoma, or Wilms tumor in a children. So these signs and symptoms should be looked for.
All right, sir. Okay. So like you told about regarding some of the misconceptions parents have. So my next question is directed towards that only. So are there any specific misconceptions about like childhood cancer that you often encounter in your practice, and what should parents know instead?
So just as I say that the concept that children cannot have cancer. How can children have cancer? They are so young, and they are not exposed to any toxins. So this is one of the misconceptions or myths. Children can also have cancer. It's not that cancer can only happen because of exposure to tobacco, smoking, or alcohol. And children cannot have cancer because they are not exposed to all these things. Children can have cancer too. Number two, all childhood cancers, they are curable. So that is not the case. It all depends upon each and every specific case. But it is also not, it is otherwise also, because there are some parents who think that childhood cancers are very aggressive and the child cannot be saved if cancer has happened in childhood only. So this must be known that including all childhood cancers and all stages of cancer, the cure rate in childhood cancer is close to 80%. So childhood cancers are very much curable if proper treatment and proper management is done. Third is one of the misconception is that all childhood cancers are linked genetically, and if one child has cancer, then there is a risk of cancer to the other sibling also, or other members of the family also. So we must understand that approximately 5% to children have maybe some inheritable genetic disorder which can cause cancer, but in 95% of cases childhood cancers doesn't mean that it is always inherited, and it can affect other siblings or other members of the family. Other misconceptions are of course that the childhood cancers are same as adult cancers. So no, childhood cancers are different from adult cancer, and the treatment of childhood cancer and adult cancer is not same, even if they have the same cancer or have the cancer of the same site. So adult leukemias and childhood leukemias, they are treated differently, and the children in fact are able to withstand treatment better as compared to adults. So this is also one of the myths that parents always think, that will the child be able to tolerate treatment? Will the child be able to undergo chemotherapy? Will the child be able to tolerate radiation? He is so young, he is so small. So this is definitely a concern. But children, they tolerate chemotherapy comparatively better as compared to adults. Yes, the side effect profile also is different in childhood cancers as compared to adults. Like long-term side effects, they are more concerning in children, and children who are cured of cancer later in adulthood may manifest with certain problems which are actually because of the childhood cancer and the cancer treatment. So this is all in short, some of the myths and misconceptions regarding childhood cancer.
Right, sir. Right. So, my next question to you is, what are some resources or support systems that parents may not know about but could significantly help them and their child?
So, if you talk about India, in India, the most important resource constraint that our patients and their families have is finance, money, access to care. And one thing parents and all the community should know, that for childhood cancer there are a lot of societies, a lot of organizations that offer financial support, psychosocial support, nutritional support, in fact even residential support in various cities, so that parents are able to continue treatment of children. So we in our hospital also, there are various organizations that have tied up with us so that we can arrange funds for patients patients of childhood cancer, so that parents are able to continue treatment even if they don't have funds. So arrangement of funds is much more easier for children, childhood patients as compared to adult patients, and there are a lot of organizations who are committed to care of childhood cancer, like India Cancer Society, Hope organization, Smile organization. Lot of organizations are there that are working specifically towards childhood cancer. Secondly, a lot of support groups, a lot of communities for discussion, and lot of resources are available on the internet, on the Facebook, on the social media sites, for the parents to interact with each other, so that it provides them a lot of emotional and social support to continue the treatment. Also, nutritional support programs are there, that is there. So, if any child has a cancer, at least I can assure that due to lack of money, the treatment won't happen is not the scenario right now, because there are a lot of organizations and resources which can arrange funds for children. Government is also happy to help them through government schemes, through Chief Minister Relief Fund, Prime Minister Relief Fund, and there are a lot of tie-ups even in private hospitals like ours, where quality treatment of children can happen with the help of these resources.
So this was really informative. I hope this information reaches out to those who are in the need. So my next question to you is, how do you see the future of genetic screening impact childhood cancer survival rates?
So, genetic risk screening, if we talk about genetic testing, we must understand there are two types of genetic testing. One is the genetic testing that is done to see whether there is any germline inheritable mutation that is present in a childhood cancer patient. This is different from a somatic mutation that is found in the child's own cancer cells. So, there are two types. One is inheritable genetic mutation or germline mutation, and second is the somatic genetic mutations. Now, both are extremely relevant. For example, there are certain genetic syndromes which can cause cancers, and which can cause cancers even in childhood also. For example, there is Lee-Fraumeni syndrome, where you can get sarcomas, leukemias in children, brain tumors in children, and in adults also. These syndromes can occur, where it can give rise to stomach cancer, breast cancer. So, if there is screening for Lee-Fraumeni syndrome in a patient, and it's positive, then their own siblings or their children can be tested for it early on in their childhood only. And if it is detected, then a proper screening program can be scheduled for the children, so that these cancers can be detected as early as possible. So this genetic screening, genetic testing facilitates early detection, early diagnosis, and if the cancer is obviously detected at an early stage, then the chances of cure are really high. There are several such examples, like there is a syndrome called Beckwith-Widman syndrome, where children can have hepatoblastoma, neuroblastoma, or a Wilms tumor. There are retinoblastoma gene alterations which can happen. There are syndromes called tuberous sclerosis, where brain tumors can happen, and then numerous NF1, neurofibromatosis 1, where brain tumors can occur. And so there are similar kind of different inheritable mutations where children can be detected with these mutations early on, and a screening can be done so that the tumor can be detected as early as possible. Second is somatic mutations. Now, every cancer, somatic mutation detection is very important, because this can, a genetic mutation testing can lead to a better risk stratification of every cancer. Now, we classify cancers as per their site or as per their stage, but nowadays the molecular classification or genomic classification is very important, and this risk stratification can help in selecting better treatment for the children. Optimal treatment, which is neither more intensified or less intensified, optimal one for the children, so that the treatment can be better suited to them, and cure rates can be high with lesser side effects. Also, such kind of somatic mutation testing can help in improving access to targeted treatment as well as immunotherapy in some of the childhood cancers. So genetic testing helps in early detection, better treatment selection, as well as increasing better survival for children with cancers.
All right, sir. So my next question to you is, what are some of the most significant breakthroughs in childhood cancer research in India over the past few years?
So if we look at the solid cancers, the solid tumors in children, So largely the treatment of solid cancers are on radiotherapy, chemotherapy and surgery. And a lot of advancements has happened in terms of just as I said, that NGS testing, genomic classification, and better risk stratification, as well as access to targeted therapy and immunotherapy. But in solid tumors, the most important advancement that has happened in India over the past few years is introduction of proton beam treatment as a modality of radiation treatment, which can offer more precision radiotherapy to children, which decreases long-term side effects and more precision application of radiation to the tumor. This proton beam therapy is now available in 2 or 3 centers all across the India. This is one of the major advancements. Second is, of course, the advent of CAR T cell treatment. So this is a type of a immunotherapy treatment our own Indian CAR T cell treatment has now been developed as a collaboration with Tata Hospital Mumbai and IIT Mumbai. And now there are several children who have received CAR T cell treatment from our own Indian generated CAR T cells. It is a complex kind of a immunotherapy treatment. The cost of a CAR T cell treatment is nearly about 2.5 crores in US. But now with the Indian CAR T cell, the cost is now somewhere near 50 lakhs. And the CAR Ts are being produced in India itself. And this is one of the major advancements that has happened, especially in the field of leukemias and lymphomas, and curing the childhood cancers are much more accessible, especially in the resistant and relapsed leukemia lymphoma cases. So CAR T cell treatment is something that has happened. Even in solid tumors, in GBM cases, now there is good data for CAR T cell treatment. And also in leukemias and lymphomas, newer treatments have come up, including some bispecific monoclonal antibodies like blinatumomab, inotuzumab. So all these molecules, CAR T cell treatment, they are more accessible now to India, and research has done so that we have developed our own Indian CAR T cell.
Right. So that's good. The survival rates, it will definitely affect the survival rates if the treatment is being done in India itself. So my last question to you is, what message would you like to give to the families affected by childhood cancer on International Childhood Cancer Day?
International Childhood Cancer Day is is an occasion to salute the children and the families, and their resilience, their fight against this cancer, and what they have gone through. It is not easy. I can totally understand, because I am a father myself, and if my child even has a cold or a cough, or a simple viral fever, we are so concerned about their health. It's a very sensitive matter. Child's health is a very, very sensitive matter. Even if cancer has happened to your child, do not worry. We understand the sensitivity of this diagnosis, and all oncologists are committed to treating childhood cancer with utmost sensitivity, with utmost care, and with utmost intent, so that we help the family as much as possible in all ways, whether it is nutritional support, whether it is financial support, whether it is psychosocial support, whether it is post treatment rehabilitation of the child. All this is given very importance, and we are all very committed to childhood cancer. Lot of support is available, and do not hesitate to visit a doctor. Don't take childhood cancers lightly. They are very curable if detected early, properly managed. Cure rates are very high, even in advanced stages. Even in stage 4, the cure rates are as high as 80%. So consult your oncologist. There are a lot of oncologists who are available, and who practice pediatric oncology also. So don't ignore childhood cancers. Don't take it lightly. But don't be disheartened. Your child will be well. There are lots and lots of children who have recovered, and they are now big names all across the India. There are so many examples, and definitely you all as a family can fight this disease and be together. We will be able to win over childhood cancer.
Thank you so much, sir, for speaking to Medical Dialogues and for your time. Thank you so much.
Thank you. It was a nice opportunity, and I thank you for giving me this opportunity.